Hi, my name is Patricia Fowler. I'm a student at Fort Hays State University in the DMP program, and this presentation is on rural health grant funding opportunities in the state of Kansas. This presentation specifically looks at the Sunflower Foundation in the state of Kansas. The Sunflower Foundation began in the year 2000 with an original $75 million settlement between Blue Cross and Blue Shield in the state of Kansas. This helped to provide the initial funding for the Sunflower Foundation. It is considered a nonprofit charity. The Sunflower Foundation works to provide grants for healthcare initiatives in three main areas in all 105 counties in the state of Kansas. The main overarching goal is to create a healthier Kansas. There's three ways that the Sunflower Foundation feels are important to do this. One is with the creation of healthy living communities. We do this through the Sunflower Trails program. Building environmental situations that have positive impacts on opportunities for people to get out and get healthy. By doing this, the foundation partners with communities for safe activity areas such as biking and walking trails, etc. The second area is through integrated care initiatives. This helps by bridging the gap between primary care and behavioral health care. It also helps to expand healthcare access and strengthen our safety net clinics in the state of Kansas. Do this by reducing barriers to healthcare and assisting to better serve our clients. And the third way is through the Sunflower Advocacy Program. This helps strengthen and stand behind those that are doing advocacy and policy work in healthcare. As part of the Healthy Living and Active Communities main area of the Sunflower Foundation, the Sunflower Trails program was started in 2005. It has helped fund over 150 projects in at least half the counties in Kansas, which is pretty far-reaching. It goes all over the state of Kansas. Anybody in Kansas can apply. This provides grant opportunities. These grants help to increase opportunities for free and equal access to environments that encourage healthy living. This is for projects that would affect all ages, abilities, and populations in Kansas. There are no barriers to that. It doesn't help just the physical health side of things, but does have an impact on mental health as well. And it provides places that the communities can come together. The second initiative was the Integrated Healthcare Initiative from the Sunflower Foundation. The goal of this was to help strengthen healthcare access, especially for vulnerable populations in Kansas. There are multiple safety net providers throughout the state, especially because of the number of rural areas that we have, which can make access to healthcare a little unequal throughout the state of Kansas, especially in those western and southwestern counties. The improved healthcare access is supported through the integrated care initiatives. There's multiple projects that can be used. These projects affect community health clinics, federally qualified health centers, community mental health centers, and health departments across the state. Some of these initiatives can reach thousands for preventative health care, mental health, all the way to dental needs. Really important to some of these populations that don't have as many resources for health care. According to the Institute of Medicine, safety net clinics provide the number one source of health care for the uninsured. Safety net clinics in Kansas are supported through the Integrated Care Initiative projects. There's been multiple, some of them can be educational and technical assistance to help formulate an integrated healthcare system. So these grants can help pay for the integrated care goals, basically. There's also learning collaborations that can benefit from this grant money as well. The website here in the yellow provides multiple resources to help better understand integrated care and help get started in funding for integrated care. Also, a part of this improved healthcare access goal is that a medical legal partnership for clients with legal barriers to healthcare. Lots of different situations that might arise there. So there are people that the Sunflower Foundation will help provide as a resource to individuals that might need that assistance. The third focus of the Sunflower Foundation was that of advocacy. The Sunflower Foundation believes that the best policy is made when the most voices are heard. There are 3 areas within advocacy that the Sunflower Foundation focuses on. The first is the Advocacy Fellowship Project. This would be like training for nonprofit leaders, trying to get people more involved in nonprofit situations. There's Advocacy and Health Speaker Series, which provides money for speakers to help increase awareness and understanding of advocacy across the state of Kansas. By doing this, we create a more cohesive healthcare situation and help stand up for what we believe in for healthcare. And then there's also capacity building. This would be more of the technical assistance, which would help make advocates more effective. When we have the technology that we need to help with all these processes, it really makes a difference to be able to provide funding for that. Multiple projects have been successful in this area. It's allowed us to initiate policies at the Kansas state level and then further at the federal level. For instance, there was a passage of a clean indoor air law that kind of started in Kansas with the help of the Sunflower Foundation. There was another support of a campaign that led to ensuring that those with mental illnesses were never turned away at a voting booth. That also began here in the state of Kansas and moved forward with that. The thought behind how these grants came about was that identifying those 3 priority areas that we've already talked about would help to focus resources a little bit better. The areas that already discussed were overall fell in line with the goal to create healthier Kansans. For funding is available to tax-exempt organizations. They must have a 501c. The funding from the Sunflower Foundation is not to supersede or override any funding provided by the government. They will give consideration to startup organizations or startup projects. If the person or organization does not yet have a 501c, they can still be considered as long as there's an agent in the place that does have a 501c. This is for tax purposes. All of this funding must be used in the state of Kansas. No funding is actually given to individuals, which makes funding for a doctorate type project a little bit tricky. You'd have to find an organization or agency to work with. There's multiple steps to the grant application process for the Sunflower Foundation. First, requests for proposals are issued by the Sunflower Foundation throughout the year. You can sign up on the website to receive notifications when these requests come out. Currently, there's no open request for proposals, but once they are opened, you can get the notifications by email, and then you can also join conference calls to better understand the purpose and see if it really meets the goals of your organization. There are guidelines for funding. We kind of talked about the 501c and being part of an organization or agency with a 501c. Applicant organizations must review the guidelines of each RFP because they won't be the same each time and see if the criteria can be met. If it's not met, you can check back with the next RFP. Once again, you'll continue to get those notifications by email of new RFPs that open. If it is met, you can move forward with the application process. You want to submit a proposal and receive confirmation that they received your proposal. Usually you'll determine whether or not your proposal and funding was granted within 60 to 90 days. You'll have to review the restrictions of the RFP to better understand when you can reapply for grant funding for this particular project. A lot of times it's within 12 months or after the 12-month period. If your grant proposal is not accepted, The Sunflower Foundation strongly recommends that you contact them to better understand how to be more competitive the next time so that maybe your proposal won't be overlooked. I just wanted to share some examples of how the Sunflower Foundation has worked to provide grants in the county of Miami County, Kansas, which is where I live. It's a rural health area in Kansas. It would be eligible to receive grant money from the Sunflower Foundation. However, for myself, if I were to wanted to do my DNP project in Miami County, I'd probably have to work with a health department or an organization that's nonprofit and has a 501c to get my grant funding approved. Historically, in Miami County, in 2016, the Sunflower Foundation provided over $9,000 to finish a 7.5-mile long trail around Myola Lake. This was originally started with a grant received in 2015. The Sunflower Foundation then provided over $32,000 for the majority of the trail to be built, which was a total of 6.8 miles around Myola Lake. So those two together kind of combined and finished that project. In 2013, the Sunflower Foundation provided the city of Paola over $17,000 to form over 3 miles of trails throughout the city. Just kind of walking and biking trails available to the community. In 2004, over $19,000 was provided to the Lewisburg School District number 416 to promote and measure activity among 1,400 students and 250 staff, which is a lot of people that they were able to reach. By doing that, they initiated a walking project. In 2003, they provided over $10,000 to Miami County Mental Health Center for software training under the focus of capacity building. This concludes my presentation on health funding in rural counties in Kansas. We kind of looked at the Sunflower Foundation and that it provides funding to all counties in Kansas, which is definitely inclusive of our rural areas that need it the most. All information found in this presentation was found at thesunflowerfoundation.org/home. From there, there's multiple links to get more information if you're interested. Thanks for watching. Have a great day.